A neurosurgeon is a medical doctor who diagnoses and treats conditions that affect your nervous system, including your brain, spinal cord, and nerves. For our health check, joining me in studio tonight to continue our conversation about neurology is neurosurgeon Dr. Bernardo Monaco with WVU Medicine Camden Clark. Dr. Monaco, thank you so much for joining us again.
Thanks, Aaron. My pleasure to be here.
Absolutely. So the first thing that I want to talk to you is something that we talked a little bit about during our health check last time, which was going the surgery route. We talked a little bit more about specifically robotic surgery, but this time I want to talk about, and it's something that you emphasize, is looking at the non-surgical side of options for things that deal with neurological conditions and spinal conditions, anything else that you treat. Why do you push that mantra?
Yeah, perfect. So thanks for this question. A lot of patients, they're gonna feel low back pain over their lives. It's a very common condition. Almost 90% of the people are gonna feel some low back pain during their lives.
Hey, I felt it before too. I've always had some low back pain too.
Do we need to do MRIs or surgery for everybody? The answer is no, Mm-hmm. So it's a very common condition. Usually it's benign. So the PCP can take care of that. If for any reason they have like neurological deficit, or they have like an investigation that shows like a neurological damage, mm-hmm. they should be referred for a neurosurgery. And in our first approach, we're gonna try to find out what's going on with the symptoms, and if the symptoms match with the findings on the imaging. If you read like a report from an MRI, it's very usual to have a lot of conditions there that's gonna scare the patient.
Right.
And they are often like normal findings on a old spine. So mm-hmm. our spine gets old as we get. So it's normal. So sometimes we have severe conditions there, like nerve like pinching, or
mm-hmm.
like a stenosis of the canal,
right.
that we need to do some surgical approach. So first thing is match the finding with the neurological exam and the symptoms, and then we address the symptoms of what's making the patient's life worse.
Right.
We try to have like different options, including like, injections, medication, mm-hmm. physical therapy. And then if we try it, like everything looks like it's a surgical thing, then we go to surgery. So
absolutely. And so I want to turn our attention to collaboration efforts. How do you collaborate with other departments like physical therapy or pain management to ensure comprehensive care?
So they are our partners, like
mm-hmm.
on our everyday life. So if you have a patient with a spinal pain, usually they need all of those, like physical therapy, exercising, injections, and pain management.
Right.
We work together. If they have a patient that they try their interventions and they are still like very symptomatic, usually they ask us like to take a look and to see if we can do something surgically to help those people. So we work very close together, and we are always, exchanging the patients and.
Absolutely. Yeah. It sounds like you guys work very cohesively together and as a great team.
Exactly. Yeah.
Now, I want to turn our attention specifically to you here. What kind of conditions do you treat in adults? And I do know a little rumor about you that you did pediatric neurosurgery. So can you tell us a little bit about that too?
Yeah, I'm a pediatric neurosurgeon as well, fellowship trained. And I'm used to do children as well. So mm-hmm. here in Camden Clark, we're dealing with brain, spinal and peripheral nerve disease.
Right.
So we are doing brain tumors, trauma, including intracranial hematomas, hydrocephalus, all like spine conditions, mm-hmm. degenerative spine conditions, pain, chronic pain and spasticity. As a pediatric neurosurgeon, I've done several selective dorsal rhizotomies. It's a procedure for, cerebral palsy patients. Mm-hmm. And we can also do those procedures for, spinal cord injured patients. And I'm happy to bring this knowledge here to Camden Clark.
Right. Well, it's wonderful that you're able to share that knowledge with us all the way here from Brazil and Sao Paulo here in the Mid-Ohio Valley. Now, one final question for you, because I know you love neurosurgery. It's what you do. So can you tell us what you're most excited about in the future with advancements in neurosurgery?
Thank you. Yeah, of course. So, as the functional neurosurgery, research goes by, we have here our Rockefeller Neuroscience Institute under WVU that is one of the gold standards for research here in the country, and so technology is something exciting. If we have those functional solutions for disease, that's what makes me like very excited. Including those neuromodulation, neuroplasticity, brain-machine interface, things like that. I think that's the future, and also, of course, robotic assisted procedures. Yeah.
Well, it certainly sounds like it's an exciting future here in the neurosurgery field. But Dr. Monaco, thank you for sitting down with us the last 2 weeks and sharing all of your knowledge on this topic.
Thank you so much, Andrew. It's a pleasure to be here.
Of course.
Thank you.
When we return Mid-Ohio Valley, we'll have one last look at your forecast. Stay with us.